Hi, my name's Chris Trevelyan. I'm a researcher in liver cancer at Leeds University, and I'm just making this video to talk about my journey with gluten ataxia, how it started out as health anxiety, or what I thought was just health anxiety, and basically the entire journey I went through from developing symptoms, first of all, battling with different doctors and looking to get a diagnosis, and then eventually getting a diagnosis and the treatment for gluten ataxia and some of the symptoms which I experienced. So to start with, um, I was always in good health, never had any health problems at all, very active. I was 20, what have I been, 25 years old when I first started having symptoms. So that was in February of 2019. Um, Everything was fine, and then one week I started to experience some very weird symptoms along the lines of um, ear pain. So I had very chronic ear pain, especially one night, was writhing in agony with the amount of earache that I had. I had some slight hearing loss, but nothing too major. Just like sort of sounded like I was listening through a shell, sort of hearing loss. Um, I also had a couple of times where I felt like I was dropping when just sitting on the edge of the bed. Just a sensation of sort of like falling through a lift type of sensation, and then generally just feeling very anxious, but not knowing why I felt anxious, and just sort of very irritable, very quick to snap, that kind of thing. So this all started to like creep on during one over the course of one week. So I was able to function completely fine. Didn't have any dizziness. Didn't have any balance problems at this point. And then towards the end of the week, I started to get intense dizziness one Saturday night. And then the next day, I was feeling very dizzy when in a shop, especially caused by sort of shelves in the shop upon each side, bright fluorescent lights, and flat floors in the shop. And that caused a great deal of anxiety. So from that point on, I was feeling basically dizzy almost 24/7. Um, but not just spinning dizziness, it was more so the sensation of feeling like I was moving, sensation of feeling like I was moving on a boat, especially, like feeling like when I was walking, it felt like a lift going up and down. It was horrendous. It was very upsetting, very confusing. Panic. I was greatly panicked. Um, but I was briefly felt sort of a bit more encouraged when reading about how this could be caused by an ear infection. So everything that was matching up. The fact that I had ear pain and an ear infection, and so I went to go see a GP who diagnosed me with viral labyrinthitis. Um, Said that this would subside within about 2 weeks. So everything was good. Yep, my family were very encouraged by hearing this as well. But in the back of my mind, I was worried, what if this doesn't go? I was always prone to health anxiety in the past. So any time where I might feel like a symptom's coming on, I'd be worried about what that actually means and whether it's going to subside or not. So I was waiting across this 2 week time period where I was still experiencing all of the balance problems, and then after 2 weeks it didn't go. So that increased my anxiety. I was panicked all the time. I was constantly googling as to what that might mean, like constantly, like all day, every day, couldn't function. All day at work, I was googling and researching symptoms. I was reading forums. I was reading medical reports. I became convinced that it was all manner of different diseases, and when one was ruled out, then I would move on to the next one. I was finding patient sort of testimonials and patient forums where they would talk about the exact symptoms I had, and then I was convinced that I would have, for example, like a brain tumor or blood cancer or you name it. I was convinced that I had it. I was convinced that the ear pain was due to a tumour behind the ear that was causing pressure there. But I was convinced that I had early onset Parkinson's disease. Anything neurological, I was convinced that I had it. So and it didn't help that during all this time, my symptoms were just getting worse and worse. So I went from being a healthy, functioning 25-year-old who exercised a lot, did a lot of running, did a lot of walking, never had, with slight tendencies to health anxiety, but only ever so slight. Otherwise, completely fine, completely normal, completely healthy. Now I was essentially nearly housebound with depression, anxiety, couldn't sleep, completely obsessed with Googling, awful, essentially. Um, and then the symptoms were just getting worse and worse to one point where I was at work one day and I just couldn't take it anymore. I was in the toilets with again a flat floor, which always made the symptoms worse, spinning, and I just couldn't take it anymore. And I was just panicked, and my workplace ended up calling for an ambulance. So I got an ambulance to hospital, but as it was a non-emergency case, I was waiting there to see a GP. The GP just said to me, "You basically just got anxiety here. I can hear complete panic in your voice. You panic about every single symptom under the sun," which I was. For example, I was even convinced that I had some kind of ongoing infection that was causing all of this, and that the colour of my tongue was different to before, and that was a sign that I had an infection. But again, I was just attaching onto anything. Anything could be the reason why. I was connecting all manner of different dots together and coming up with the most awful of diagnoses and diagnosing myself. But I wouldn't listen to anyone at this point. I wouldn't hear what anyone was saying. I was convinced that I was going to die. So my parents said, come home, because I was working away at the time. Said, come home for 2 weeks. Low anxiety setting. Get the stress down. And because of where I was at that time, I was just depressed and anxious and living on my own. It just wasn't good for my health at all. So I go home. That helped subside a lot of the stress, and I came across on YouTube health anxiety. So watching videos on health anxiety really, really, really did help lower the stress levels, because I was seeing a lot of the symptoms that I was experiencing being reported by other people, and that helped me to think, okay, well, it's not definitely a brain tumor. It could just be health anxiety, and I'll just give this a go of believing and telling myself it's health anxiety. It's health anxiety. Just repeating it to myself anytime I came on, just saying it's health anxiety. But eventually, this coping mechanism wasn't enough, and the frame of mind I was in at that point, I was just basically looking for any new coping mechanism would work for a couple of days, and then I was convinced again that it was a brain tumor. I then went to a hypnotherapist to try and help with this, to try and snap me out of focusing on the symptoms. Again, this worked for a few days, but the fact that the symptoms remained was still the overriding issue. With a lot of people with health anxiety, symptoms will eventually go when the anxiety level drops, but mine wasn't going. So I pursued with the doctors to follow down the ear route. I then believed that perhaps this ear infection that I had originally in the ear pain had caused damage to my balance centre. So I, fortunately, with the workplace I was at, went and sought private medical insurance, and so I went to go see an ear specialist in Cambridge. I had scans done, and I convinced them to allow me to have an MRI scan of my brain as well, because I was convinced that there was a problem there. And essentially the problems came back showing that there was no problems with my brain, and there was no problems with my ears as well. I then became convinced that I had a rare problem with my ear, which I can't remember off the top of my name, but off the top of my head, but it's essentially where you get a small hole in your ear, and that can cause pressure differences that could cause balance problems. So I underwent a surgery and an operation to fill a potential small hole which couldn't be seen. Again, didn't make a difference at all. So I'm going to some quite extreme measures at this point. Didn't make a difference at all to my balance problems. My balance problems were still there. I then became convinced that I developed a condition called MDDS, which stands for mal-débarquement syndrome, which occurs after somebody disembarks a stressful or just basically any kind of voyage. It can occur after a cruise or after a train or after a plane ride, and it can leave people feeling those symptoms basically forever. And this can be caused by stress as well, so it can be caused when you don't have transportation. So I became convinced I've got this lifelong balance condition called mal-débarquement syndrome. It's never going to go. My life is nothing. Depressed. What's the point in living anymore? Starting to feel slightly on the edge of what is the point in life anymore if I've gone from being 25 years old, can do whatever I want, I'm happy, I can do whatever, I've got the world in front of me, to this point where I felt like I was just house-ridden, bedridden, my life is over, there's nothing worth living for. So what happened was, from February 2019 to talking the winter time of 2020, I'm just seeing specialist after specialist after specialist after specialist, searching for diagnoses and not getting anywhere. And then eventually, I paid to go to a private balance clinic in Sheffield, which wasn't far from where I live in Bradford. And the point of that was just to try and get some physiotherapy exercises to help with the balance problems. So during this time, I was doing a PhD in science in cardiovascular disease, because I didn't want it to rob me of my life. So I was continuing to function and work and try and achieve my goals, but I was just feeling completely just depressed and just sad all the time, because all of these balance issues were just occurring in my brain. These sensations were always there all the time, and it just felt sad knowing that other people weren't experiencing them and I had to experience them, and it was just so depressing. So I went to this balance clinic just to try and get some exercises to help with the sensations. And whilst I was there, the specialist happened to ask me whether or not I'd suffered from any gluten sensitivity with my stomach. This was the case, so I've always had some problems, slight problems with my stomach with when eating gluten, but I'd never got a positive celiac test. So I've done a celiac test like 4 times, and all of them were negative. He said that gluten could be the cause of my balance problems, and it wouldn't matter whether I had celiac disease or not. So he referred me to go and see a specialist at Royal Hallamshire Hospital in Sheffield, called Professor Marios Hadjivassiliou, who's an expert in a disease called gluten ataxia. And essentially, gluten ataxia is a disease where the body responds to the ingestion of gluten by producing antibodies, but these antibodies can become what they call autoantibodies. So it means that they can attack parts of the cerebellum in the brain and lead to balance problems and dizziness, and it can also cause speech problems and coordination problems and memory problems as well. So I waited for this first appointment, spoken through my symptoms, and he arranged for me to have a blood test done and also for a special MRI scan of my brain called an MRI scan with spectroscopy. And essentially, this kind of scan measures chemical changes across the brain, and it can see where some cells may not be present anymore because they've been damaged, or those cells have died due to attacks from different antibodies. So I awaited the results of both my blood test and my brain scan, and around July or August of 2020, I received a letter to confirm that I had tested positive for gluten ataxia, both through the blood test and through the brain scan. So this was a massively relieving time for me. I'd finally reached a diagnosis, and all the doctors that told me that it was just stress, just anxiety and nothing more, were wrong. I don't blame them, because it's a very rare condition, but it just felt like such a relief that I pursued it and advocated for myself and chased down diagnoses, and I finally got a diagnosis. So the treatment was laid out to me there was that there is only one treatment for gluten ataxia, and that is a strict gluten-free diet. You can't have any gluten whatsoever, and that's to avoid cross-contamination as well. So it means that, like for example, you can't toast bread in the same toast that has been used for normal bread as well. You have to be extremely strict to not ingest any gluten at all, and that with doing this, you can potentially reverse any damage that the gluten has caused. So that's really important to notice. It depends on how long this damage has been caused. So some people are very unfortunate and not lucky in that it takes them a long time to get a diagnosis, or they'll listen to doctors who tell them that it is just stress and anxiety, and they give up looking for a diagnosis, and all the time they'd be eating this gluten, which is causing damage to their brain and potentially gets to a point where it's not reversible anymore. So I was told that with eating a strict gluten-free diet, there's no reason why I couldn't reverse this damage. So that's what I started doing. I went completely strict gluten-free. But a year later, I still didn't feel like I was seeing any results. So I was still like slightly looking online at different causes it could be. The health anxiety was still slightly there. I was still slightly depressed. I was still getting balance problems, especially when after transportation. So that's always something that would make it worse, is going on transportation like boats or like trains, or looking at screens for a long period of time. So it definitely affected all of my balance sensor. But I pursued with a gluten-free diet, and then after a year or so, I started to see the improvements. So I've started to see the balance problems reversing, to the point where I'm at now, where I still will experience slight balance issues. Like, I'm not gonna lie, I still get things, but they're so minuscule that like I can so easily deal with them. Like, I run regularly at the moment. Like I run like for a few times a week, like 8Ks, 7Ks, 5Ks. Like I work a full-time job, commute via train and walking. I live a very normal life. I own my own home. I'm a research fellow at university. I can do so much with my life now, whereas before it just felt like my life was basically at an end, and that was only possible through completely eliminating gluten. So it's just feels like a different world now to where I was at before, where I was undergoing cognitive behavioural therapy and taking antidepressants just to kind of cope with these symptoms that had no answer to them, because I was being told by every doctor that I saw that I just had anxiety, it was just stress, and that there was nothing more. But because I looked out for myself and I pursued it to the end, I finally got a diagnosis, and a rare diagnosis at that. So I would say to anyone who's got the same kind of symptoms as what I had, balance problems, feeling like everything is swaying and moving, that kind of thing, to just really be an advocate for yourself. Don't give up, because it might not be that it is stress, and it might be that there is something underlying there, and that you can undergo some treatment for it. And that's not to say that there is such a thing as health anxiety, because there is, and people with health anxiety do experience dizziness and balance problems as well. But it's important to get the stress down, get the stress levels down, so that you can actually work out what it is that could be causing it. And that's the main thing. Like, everyone would say that to me back then: get the stress down, then we can work it out. But I wouldn't listen to them, because you're convinced that you're dying, you're convinced that you've got some horrible illness. But the main thing is, if you get the scans, like an MRI, like a brain scan, it just completely set your mind at ease, and you'll know that it's absolutely nothing extremely serious at that point. Then you can go on and see if it's something like gluten ataxia. So if you found this video useful, please subscribe, because I'll do more videos in the future talking about my symptoms and talking about the kind of things that have helped. And please like and comment on the video if you want to ask me any questions at all. I'll reply in the comments. It was so useful for me back then to look on YouTube and find people talking about this kind of thing. So anything that I can do to help anyone going through the exact same things that I went through, it would mean the world to me to help people like yourselves. So yes, please subscribe and comment, and I'll answer any questions you've got. I've been Chris. Thanks for watching, and stay tuned for more videos.